depression, anxiety, and stress. These aren't just buzzwords to describe mental health, but real-life experiences that many, including you, may have faced. Yet very few realize these conditions could turn deadly. But you might want to ask, how does my mental health affect my physical health? Today on MindScope, we break down mental health and its connection to stroke. In this video, you'll discover how you are at risk of stroke when your mental health is at stake. Before we dive into the heart of the matter, let's talk about mental health and what it has to do with your physical health. Understanding the connection between the mental and physical state. While mental health seems to be thrown around a lot on social media, it's actually way deeper than that. Mental health isn't just the absence of mental illness, but it's about the well-being of your emotional and psychological state. It affects your overall well-being, basically. So just because you lost a football game doesn't mean your mental health is at stake. Mental disorders in people tend to lead to physical health conditions, such as heart disease or stroke. Similarly, studies show that nearly 1 in 3 people with a long-term physical health condition also has mental health problems, most often depression or anxiety. This is why we'll talk about these familiar faces: depression, anxiety, and stress. Depression isn't just a short wave of unhappiness, but it's a state of mind producing a serious long-term sadness and brokenness. It's an inability to visualize a happy future. So you might want to stop throwing the word around carelessly. Depression can come with headaches, fatigue, and digestive issues, while anxiety can even upset your stomach. Anxiety can seem ordinary, but when it comes to mental health, it's a state of restlessness, agitation, and mental uneasiness. Stress, on the other hand, is suffering from emotional pressure or strain and discomfort. These prevalent conditions may seem pretty normal, but they could take a toll on your physical health. This could be for a couple of reasons. Genetic link. You see, the very genes that raise your susceptibility to mental health challenges can also contribute to physical health problems. It's a complex interplay that affects a lot of people. Low motivation. Now, let's talk about motivation. In some cases, certain mental health conditions or medications can zap your energy and motivation, making self-care a real challenge. Concentration and planning. Concentration and planning are vital for staying on top of your health, right? But if your mental health affects these abilities, it can be tough to organize and attend medical appointments. Lack of support. Another critical issue is the lack of support for behavior change. Some healthcare professionals might underestimate your ability to make positive changes, like cutting down on drinking or quitting smoking, which we know is possible with the right support. Reduced access to medical care. People with mental health conditions often face reduced access to medical care. Some health providers might assume that physical symptoms are merely a part of the mental illness, potentially delaying the detection of physical health issues. Now that we've established the connection between mental health and physical health, let's get back to the heart of the matter. Stroke risk. What's at stake? A stroke is essentially your brain's version of a heart attack. It happens when something goes wrong with the blood flow to a part of your brain. This can be caused by either blood vessels getting blocked or by bleeding within the brain itself. Now, here's the critical part to remember. Strokes are not to be taken lightly. They are indeed life-threatening emergencies. Immediate medical attention can be the difference between preventing permanent damage and even saving a life. Just to be clear, anyone can have a stroke, from children to adults. But hey, you don't need to panic. Some people stand a higher risk than others. While strokes are common to old folks about the age of 65 and above, people with high blood pressure, high cholesterol, hyperlipidemia, and type 2 diabetes are at higher risk of suffering stroke. Not only is it a leading cause of disability in the world, but research uncovered it to also be the 5th cause of death. So it's a big deal, you see. But how does it affect your body? Picture this. A stroke is to your brain what a heart attack is to your heart. When a stroke occurs, it's like a part of your brain suddenly loses its blood supply. Without that blood, the affected brain area doesn't receive the oxygen it desperately needs. This leads to brain cells becoming oxygen-starved and functioning improperly. Now here's the key point to remember. If your brain cells go without oxygen for too long, they'll eventually die. And if enough of them in a specific area die, that's when the damage becomes permanent. You might lose the abilities that particular part of the brain once controlled. But restoring blood flow can prevent, or at least limit, this damage. That's why time is absolutely critical when it comes to treating a stroke. Now, how does mental health actually influence our stroke risk? It's a complex puzzle, but we're here to solve it for you. Understanding the connection between mental health and stroke, breaking the link. Remember how we talked about depression, anxiety, and stress? Turns out these aren't just mere conditions when it comes to mental health and stroke risk. Stress factor. First up, stress. Before you begin glorifying how much stress you endure in your everyday life, just know that stress is no friend of yours when it comes to mental health. In fact, chronic stress is like the sneaky villain in this story. It can lead to high blood pressure, inflammation, and plaque buildup in your arteries. All these are big players in the stroke risk game. And you know something about coping with stress in unhealthy ways, like excessive drinking or substance use? That's a red flag. And these habits are strongly linked to a higher risk of strokes. Depression's role. Now let's talk about depression's role in all this. Remember, it's more than just feeling down. Well, it can lead to unhealthy habits like a poor diet and smoking. These bad boys are stroke risk factors. Have you ever wondered how some people get addicted to smoking and find it difficult to quit? It's not just a vice. They have depression's role in their mental health, which in turn links to stroke risk. Plus, it might mess with your nervous system, influencing your heart rate and blood pressure. So the next time you want to light a cigar or vape, remember you're at risk of a stroke. Anxiety and stroke. And here's anxiety, another key player in the mental health stroke connection. When anxiety kicks in, it's like hitting the gas pedal on your body's stress response. Your heart races, and blood pressure spikes. And if this happens often, it could lead to hypertension, a major stroke risk factor, meds, lifestyle, and inflammation. But that's not all. Some individuals with mental health conditions might not stick to their medications. Oftentimes, patients tend to stop taking their medications after a while, especially when they think they're getting better. But missing meds can mess with other health issues, like high blood pressure or diabetes, making strokes more likely. Inflammation connection. Mental health conditions like depression might trigger chronic inflammation in your body. This inflammation can set the stage for other stroke risk factors to do their damage. Social isolation. And here's a twist. Feeling lonely can lead to increased stress and even more mental health challenges. Locking yourself in your room all day and avoiding social interactions aren't just about being an introvert, but these feelings take a toll on your mental health. Then your depression rate increases. These can significantly up your stroke risk. Blood clot surprise. Lastly, some mental health conditions make your blood more likely to clot. Clots can clog up your arteries and lead to ischemic strokes. This typically occurs when something obstructs the blood vessels in your brain, cutting off the blood supply. Ischemic strokes are the most common, accounting for approximately 80% of all strokes. And it could happen in 3 ways. Clot formation in your brain, thrombosis. Imagine a clot forming right in your brain, leading to an ischemic stroke. It's like a roadblock in your blood vessels. Clot fragment from elsewhere, embolism. Sometimes a clot originating elsewhere in your body breaks free and embarks on a journey through your blood vessels until it gets stuck in your brain, causing an ischemic stroke. Small vessel blockage, lacunar stroke. This can occur when you have uncontrolled long-term high blood pressure, hypertension, high cholesterol, hyperlipidemia, or elevated blood sugar levels, type 2 diabetes. It's like a traffic jam in your tiny brain vessels. And it's a wrap on this. Now remember, this relationship goes both ways. Mental health issues can increase stroke risk, but having a stroke can also take a toll on your mental health. It's more like a two-way street. So here's the deal. Understanding the connection between mental health and stroke risk is like putting together a puzzle. It's complex, but knowing the pieces can empower you to take charge of your health. Want to learn how you can help yourself? Watch out for more videos.